Now, relative to the craniomandibular disorders, it's a must that you have to work at the level of the craniovertebral joints. Don't forget that we're dealing with a functional unit of the craniomandibular system that has a very specific joint, which is the temporomandibular joint. So, when dealing with temporomandibular joint disorders, you have to realize that all the action at this level, or the tension of the muscles of the face, are also parafunctional activities at the level of occiput, atlas, and axis. Not only joint-wise, but also muscle-wise. So we have to do a complete series of joint mobilization and neuromuscular re-education to treat and stabilize also the craniovertebral joints, to restore occiput, atlas, axis functional spaces, and also to restore the normal alignment of the craniovertebral angulation. So we need to have craniovertebral joints aligned in the three planes of space, in the sagittal plane, in the coronal plane, and in the horizontal plane. The first, most simple procedure is always make sure that the coronal plane of the patient is parallel to the table. So the patient does not need a pillow in order to be able to have the tectorial membrane relaxed, not in tension, that will allow us to do distraction. Don't forget that the tectorial membrane limits distractions and limits craniovertebral flexion. So we set her in neutral. The head is always going to be supported over the table, and we're going to be using basically all the area from the mastoid down to the occiput as the area of our hand support. And here we can set our hands on the occiput, mastoid, and on the rest of the cranium, and just do a long axis distraction, unspecific, to relieve the tension of the soft tissues between the cranium, cervical spine, and shoulder girdle.